Well, the federal COVID-19 public health emergency ended back on May 11th. Jen Thompson, though, learned that while the infection is not gone, the pandemic is said to be behind us.
That's right. Jen.
COVID-19 turned our lives upside down, showed us what a new normal meant. Now, in the endemic phase, many still battle the lingering effects that the last 3 years have had on us. On May 11th, the public health emergency declared in response to COVID-19 expired.
I think that it's appropriate to declare, with the changes that have occurred, the decreased virulence of the illness, that we have reached an endemic phase. And with that, it is appropriate to end the government emergency. And that, of course, means things for our society with regard to businesses, healthcare, and so forth.
Knox County Health Officer Alan Stewart says the risk is down enough that we can't ignore the virus, but we have to move on.
One thing the pandemic has done is drawn significant attention to public health. With the governor's public health program, which I applaud him for, hopefully we will be taking not just the COVID pandemic, the lessons we have learned from that, but applying that to healthcare in Indiana and making public health more of a priority.
While COVID-19 will still be around, Dr. Stewart says it will not cause as much of a problem. Billy Wenzel, Director of Behavioral Health at Turning Leaf, still sees the effects of COVID.
We are still seeing a lot of effects, a lot of people coming in, a lot of fear. I have a lot of clients that are afraid that it's going to happen again. And I've had a couple clients that have said, you know, all these years that, you know, you have your life and you don't think that the world's going to stop. And now knowing that it can so suddenly has really put a lot of fear into the minds of people.
Wenzel says with the increased trauma and anxiety, they have also seen an increase in addictions.
What we're finding now is that there are so many cases of anxiety, and a lot of them are from people that have never had anxiety, but since the pandemic. So the isolation portion was a big part of it, the depression of being away from family and friends, but the anxiety of the unknown too. Turning
Leaf recently expanded their services to include teens and young adults, a population that Wenzel says they are seeing a huge increase of mental health needs.
Of course, it's hard to be a teenager anyway, but a lot of them had a couple years where they were either homeschooled or virtual, so they may have lost some of their skills. Some have lost proms, they've lost graduations, they've lost all those important milestones that kids need to have.
Wenzel encourages those struggling to find a support person, a friend, a family member, a teacher, even a therapist, and not to be afraid or ashamed to reach out for help.
There's a stigma when it comes to mental health, and I do think that the teenage generation, a lot of them, they don't have the stigma as the older do, and I think that's really good. A lot of them have realized it's okay to not be okay.
Wenzel told me that the signs of anxiety vary greatly from person to person, but she says if you know that you are not feeling good and you're a little nervous more than usual, it's a pretty good indication that you should talk to somebody or ask for help. Mike?
All right, thanks, Jen, for that report.